Hi, I'm Dr. Gerald Deas. Welcome to Health Center from Downstate Medical Center. To you folks out there, I know you go to the physicians and have an examination, and often the physician might feel around your throat here. You know, usually your throat is generally nice, symmetrical, and so forth, but in some cases it could be enlarged, a little larger than what it should be, and he might palpate it, feel it, and so forth, and he'll say, you know, he'll maybe make a diagnosis that you're having some problem with your thyroid gland. Now, the thyroid gland controls so many things in the body. It's like it senses everything. The heart depends upon it, blood pressure. It's all over the body. The hormone that it puts out, known as thyroxine. Sometimes if it's too much thyroxine or too much hormone, the heart beats fast. If there's too little hormone, it beats like that. So the doctor can tell even from listening to your heartbeat or just looking at you in generally and feeling your thyroid gland that they might have to be evaluated. And this is a very important gland to evaluate. And so today we're going to discuss some of these things and why you should be concerned with your thyroid gland or symptoms of certain things, or when you have a high amount of thyroxine being poured out or a lower amount, and maybe help you when you go to your next doctor or for an appointment to be able to more or less educate him that you know a lot about the thyroid gland. We have Dr. George Schussler here, who's been here since 1979. I mean, he's one of our endocrinologists that came here at that time, and he specialized in the thyroid gland. Although he is known as an endocrinologist, it just doesn't mean the thyroid gland. It's all the glands in the body, everything from the pancreas and things like this that causes diabetes if it's with the insulin problem. So I want to welcome you, Dr. Schussler.
Nice to be here.
Yes, Dr. Schussler. And you know, I know you came here in 1979, and you were kind of became an expert in doing different things with the hormone known as thyroxine and things like this. And maybe you could just give us a little idea about this thyroid gland. How important is it in our body?
Well, it's important, but so are all the other glands.
Surely.
The beautiful thing about the thyroid is if you catch a deficiency in thyroid hormone secretion early, too much or too little, it's almost always completely reversible.
Oh,
so this is very important to check that, and very easily done. We can easily measure thyroid hormone levels.
Yes.
And as you pointed out, the examination is probably the easiest of any endocrine gland because it's right on the surface, right at the neck.
Right, sure.
So it's easily examined. And if there is a little tumor or something like that, it can be assessed, it can be biopsied, and it can be treated in most instances.
Right. You know, we were talking just before we came on the program here about how important the thyroid gland is in pregnancy, or even if a person is thinking about becoming pregnant.
Well, I think that's a terrifically important point. I'm very glad that you brought it up. Thyroid hormone experiments in high school are putting thyroid hormone in with a tadpole and showing that it changes into a frog. That's a miraculous kind of thing that thyroid hormone does.
I see.
And a very well-known experiment. The reason I bring it up is that thyroid hormone is critical for development. And once the stage of development is over, the lack of thyroid hormone can't be addressed anymore. It can't be reversed. So it is, I think, essential that every woman who plans to become pregnant have her thyroid hormone level evaluated. Just the fact that she plans to become pregnant or is in the first stage of pregnancy, that should be done.
Right.
Because one, it's important for the development of the baby, terrifically important, mental development in particular.
Wow.
And second, and super important, it is completely treatable. So if you pick it up, you can treat it.
Right. Now, how many persons do you think is missed because the doctors really don't do this test? Would you say that this should be an essential part of the whole workup in their pregnancy?
I think it is now. I think it's become an
Okay.
essential part of the workup in pregnancy, so I don't think it's missed. The point, of course, is that very often women don't go to see their obstetrician until they're pretty far along in pregnancy. And my suggestion would be that you should go as soon as you know you're pregnant.
Right.
Because this can be remedied. It doesn't have to interfere with the pregnancy. It can be treated very easily. And the result of not treating it is so disastrous and so permanent that you surely want to avoid that.
Well, I think that's such a very important piece of
Yes.
information. Now, if we have a normal thyroid, for example, and the thyroid becomes overactive, we call it hyperthyroidism. What are some of the symptoms that a person coming into a doctor's office would have with an overactive thyroid?
I would think that the single most obvious symptom would be very nervous, very hyperreactive, that sort of thing. But the thing that you look for on the examination immediately is a fast pulse. So somebody has, we call it tachycardia, has a fast pulse continuously.
Right.
That implies possibly that it may be due to excess thyroid hormone. There are other reasons, as you well know.
Surely.
But the beautiful thing about thyrotoxicosis, and I know I'm repeating myself, is again, completely treatable. You can reverse it completely so that if you are found to be thyrotoxic, you can come back to normal with very easy therapy.
Well, now another thing you would say, they would be trembling sometime, very nervous, very fast pulse,
yeah.
very fast pulse. Would they
Sweating, being warm.
How about weight loss?
And weight loss is characteristic, and being very nervous.
I see, right.
Irritable, nervous,
Yes.
Easily upset.
Right.
And that can all be cured by treating the thyroid.
Well, you know, one of the older physicians I had when I was in medical school here at Downstate, he said when a person has a tremor like this here, could you put your hands up? He said if that tremor is transferred to you, that's also an indication that thyroid might be a problem.
Okay.
Otherwise, you could press out the tremor.
Right.
You know, and
Well, I've learned something. I didn't know that, but
So
that sounds very likely.
Well,
yeah.
you know, in our days, on my days and your days too, physical diagnosis was very important.
Right, but that brings up an important point. Physical diagnosis is very important, and it's fallible.
Okay.
The laboratory examination for the thyroid is now many, many decades old and 100% reliable. If a physician suspects that you are underactive hypothyroid or overactive hyperthyroid, he can draw one blood and know within 24 hours whether his diagnosis is correct or not.
Yes.
So it is one of the easiest conditions to diagnose, and as I mentioned, also one of the easiest to treat.
Now, how many folks do you think go undiagnosed, and you know, and wind up with, say, even diabetes, and it makes the diabetes even worse if you have an overactive thyroid?
Well, I don't want to imply that an overactive thyroid by itself causes diabetes.
No,
I don't think that happens. It would make it worse. I think you're right about that. I think nowadays we probably catch virtually, very high percentage of the people because there's medical examinations are fairly readily available. And the point here is that you don't want to go for 2 or 3 years, which you may go between medical examinations, having this condition without knowing about it. So a program like yours is very useful to indicate what are the symptoms that you should think about, consider, and it should be part of a standard examination of the patient.
Right. You know, sometimes I have seen, even in hyperthyroidism, hair loss.
And typically very fine hair.
Very fine hair.
Very
yes.
fine hair, very fine skin.
Right.
The kind of skin that many people would like to have. It's the opposite of the coarse skin of hypothyroidism. In hypothyroidism, you become underactive, the voice becomes hoarse, slow. Mentation becomes very slow, the skin becomes thick and extremely dry. Reaction time is slowed down.
And weight gain is another part of that?
You know everything, exactly right. Yeah. Weight gain, unaccounted for weight gain. Although weight gain is so common that I can't bring it out as a leading symptom of hypothyroidism. But it should be considered, and it's a matter of one blood test which can be reported in 24 hours. Very, very easy.
And it's one of these kind of conditions where the person will almost say you're God when you diagnose it, when they get better so fast, you know?
Right, you do get better very quickly.
Very quickly, you know, and they've been feeling terrible, their memory is down.
But it's the point that you made before, I would like to emphasize very much. I think that every pregnant woman should have an examination because the effects are completely reversible in the adult, which you just emphasized. but they are irreversible in the fetus, in the baby.
Right. Now, among our, say, ethnic groups, are there white and African American? Is it more hypothyroidism or hyperthyroidism in any of those groups? I say one over the other.
I'm not really aware of it. We have a population that is very largely Afro-American,
Right.
and we have a very high incidence of thyrotoxicosis. The story about thyrotox is frequently that there is a stressful stimulus. Some kind of stress occurs before the thyrotoxicosis becomes evident.
Yes, yes.
But I'm not sure that there is a racial predilection.
Well, you know, I had seen in the clinic people who want to lose weight,
Yes.
and they lose it very fast. And all of a sudden, they didn't have hyperthyroidism before, but they developed hyperthyroidism
How do you know?
because we did the test.
Now, how do you know that they didn't have hyperthyroidism before? You didn't
Well,
do a test before.
No, you didn't do the test before, right?
You know, terrific success at weight loss, I think you're suggesting may be an indication that a patient is hyperthyroid.
No,
Even
due,
if it's
due
intentional.
due to the weight loss, they
Yeah.
become hyperthyroid.
I would say absolutely not.
Okay. All right.
My point of view is, and I've studied this, I know
Okay.
something about this.
Right.
It is almost the exact opposite.
Okay.
If you starve an animal, an experimental animal, or if you have someone reduce his caloric intake, thyroid function goes down, which is an appropriate compensation because thyroid function increases the metabolism, right?
Naturally.
You need more oxygen, you burn more calories. So when food is in short supply, thyroid function gradually goes down.
I see, okay.
And it's a very important adaptation.
Right, right. Now, in hypothyroid, we'll go when the thyroid is down. One other physical diagnosis we were talking about, examining a patient. One examination I was taught a long time ago, if a patient got on your examining table and they kneeled.
And
you
they what?
They kneeled on the table,
Yeah.
and you took and you tapped their Achilles tendon. Usually, normally, it goes up like that. The foot will go up and down. But when you tap it in a hypothyroid, it'll go up and come down slowly.
Right. You know your endocrinology very well. That's called the hung reflex.
Yes, right.
And it's typical of hypothyroidism.
Yes.
And it used to be an essential part of the diagnosis. But now all you need is one tube of blood, and you
Right.
have the answer in 24 hours. But it is a very good part of the examination.
Yes,
Right.
yes.
The voice becomes husky, lower pitched. The skin becomes extremely dry. Women are often aware of that, and that may be a principal complaint.
Right,
So those are some of the things to look for, and the patient feels cold.
right, right. Well, you know, another thing that I have seen also is, I don't know if you call it the teacup problem or anything like that, or but when a person handles a teacup, for example, and is trembling when they bring it to you, sometimes that is another indication that thyroid is kind of overactive.
It could be. It would be worth looking for it, right?
Yes.
Or they may just be being interviewed on TV and becoming extremely nervous. That's
Right,
the other
right.
possibility, right?
Right.
No, but you're right.
Right.
This tremor, and the way to look for the tremor is to ask the patient to stretch out his hand like this, and then you put your hand against it, and you feel it as like an electric tremor.
Right, right.
Right.
Now, the thyroid gland does develop tumors sometimes. They can be, I guess, malignant tumors or non-malignant tumors. They can be nodules. Think of the old days when certain parts of the country, the thyroid gland would get this large because of the lack of
Iron
iodine.
deficiency, right.
Isn't
And
that
in
interesting?
Africa, this is very common.
Yes, isn't
certain
that
parts of
interesting when you
Africa.
think about how just one element like iodine can give you in a large thyroid level?
Because it's essential
Yes,
for
right.
thyroid hormone. Thyroid hormone carries 4 iodines. Iodines are huge atoms. They weigh 127 compared to carbon, which is 12.
I see.
You don't want to hear all that.
No, that's okay.
Yeah.
That's fine.
So they're enormous. They make up most of the molecule, and there are
Yes.
4 iodines. And in countries that have iodine deficiency, the thyroid tries to make up for that deficiency by getting larger and taking in as much iodine as it can.
Right.
So we have goitrous regions of the world, and we have people, immigrants, coming into the United States, often with large goiters, because they come, for example, from parts of Africa that are iodine deficient.
Iodine.
Iodine deficient.
Deficient, yes.
Right.
Yes.
Same as iodine.
Yes, right,
Right.
surely.
They don't have enough of it, so the thyroid tries to compensate by getting very large. And it can get so large that it becomes dangerous and cuts off circulation. But the main point is that as a public health measure, all over the world, iodine is being supplemented so that no longer happens to kids.
That's right. Well,
Yeah.
folks, you know, they talk about sea salt, regular salt, and so forth. But just think how they took a salt that you use every day and they put iodine in it, and
Right, and it prevents this.
iodized salt.
Right.
And this is important because I imagine areas
You know
where-
everything. You're absolutely right. It was
Yeah.
very important, and particularly important in those countries where there is iodine deficiency.
Yeah, yeah.
Right.
Now, as far as tumors of the thyroid now, we'll speak of a nodular. When you palpate the gland and it feels kind of nodular, what would be the kind of workup that you would put a patient through?
Well, there are two kinds of nodularity. You may have multinodularity, which is probably a fundamental process in the thyroid and may contain a malignant tumor or may not.
Right.
The other thing is that you may have a single nodule that's getting larger, which is a little bit more scary. And we have something called a radioactive iodine uptake, where the patient is given radioactive iodine and then a picture is taken of the thyroid.
Right.
And typically tumors don't take up the radioactive iodine. So a cold nodule becomes a little bit suspicious. Most likely it's okay,
Right, yes.
but it becomes more suspicious than the rest of the gland. So what we do then when we see a cold nodule is take a skinny little needle, it hardly hurts, it's like an injection, and take out a tiny bit of tissue, it's called a biopsy, and that can tell us if it's benign and can be left in place or is malignant and needs to be taken out.
I see.
So the important point is that if the patient is aware that they've gotten a little bump in the thyroid,
Right.
confirm that with a physician, and ask him if he wants to do a biopsy.
Right. And that's so important because that cold nodule is important from the standpoint that, like you say, it might be malignant and you can...
Right, it might be, but the nice thing is that overwhelmingly it's not going to be malignant.
Right, okay.
Most of them are going to be benign.
Right, yes.
So you don't have to be terribly fearful about it, but you should get a little biopsy. You can have the result in 24 hours usually.
Well, you look like a supermarket where you can get everything done in 24 hours.
Yes, I keep saying 24 hours.
That's all right, though.
But I know,
because it's so
that if
important.
you're worried about something, you want the answer quickly.
That's right,
Yeah,
but it's
right.
something that you say can
Yeah.
be diagnosed in
Right.
24 hours in a
Right.
sense,
Right.
which is a wonderful thing because
True.
there are very few things that you can get that fast, you know.
Right.
I know that I've had patients with those kind of things and they want to know in 24 hours just what's going on.
But most of the patients I see, it seems to me, don't want to know and go on sometimes for years not knowing, not wanting to know, and then finally come to see the doctor, which is a very bad tactic.
All right.
You shouldn't be fearful. It's easily treatable, even if it's malignant.
Right.
Most of our patients are cured.
Right.
So that the point is, don't let it go. Get to the doctor, have him do a biopsy, and make a decision.
Well, you know, with such poor medical care we have today, when I say medical care, I mean folks that have insurance to go to a doctor and to get sophisticated tests when they don't have insurance and things like this. It takes a lot of money to make a diagnosis. you
Well,
know?
if I may differ with you a little bit because I'm based at Kings County Hospital.
Well, that's different, yes, surely.
And I know at Kings County Hospital, if a patient came into the emergency room and was worried about a growth on his thyroid,
Right.
he would probably have a biopsy within that visit or within a few days,
Okay.
and have a diagnosis made.
Right, yes, yes. But I'm talking about
And not
the folks
terribly
who,
expensive.
Yeah, I'm talking about the folks who don't feel they have enough money to go to the doctor and they
Right.
say, I'll let it go.
Right.
It's not bothering me.
Right.
You know, most of
Right.
the time they'll say it's not bothering me, so I'll leave it alone.
Exactly
you know?
right.
And so consequently, by the time they get to the doctor, it's way along its way, you know, and things
Yeah.
like this. But as far as
The worry is metastasis, right?
Sure,
Yeah.
sure. And I've seen that happen
Yes.
in my practice as such, you know.
But the beautiful thing is that it is so relative, medicine is complicated, difficult diagnoses are made, but it's so relatively simple to diagnose. The procedures are standard, and the treatment is relatively straightforward.
Right.
So it's not something to be terribly fearful of and delay and delay and delay.
Right.
Rather have your doctor feel it right away.
Right. Now, diabetes and the thyroid gland. Could you give us some remarks about diabetes and the relationship, not there is a relationship, but what we could expect if you have diabetes and a high, say, hypothyroidism.
Well, you've had the great experience recently.
Hypothyroidism.
Yeah. Well, hypothyroidism makes the diabetes considerably worse.
Okay.
And it's much easier to control if you treat the thyrotoxicosis. Diabetes, as you know, is a lifelong disease that will need care for the rest of the patient's life. Thyrotoxicosis is eminently curable. The only problem with the cure of thyrotoxicosis is that sometimes it leads to the opposite. It leads to hypothyroidism.
I see.
But hypothyroidism can be treated with 1 tablet a day, 100 micrograms of thyroxine, and you're perfectly normal.
Right.
So the nice thing about what we're discussing is that diseases associated with the thyroid are relatively easy to diagnose and to treat, essentially curable. And that's why there should be no delay in making the diagnosis.
Yes. Well, you know, as far as children having thyroid problems, could you?
Well, that reminds me of something before we get to children. The pregnant woman
Yes, right.
is the most important thing. I guess we already mentioned it,
Yes.
but it is terribly important, and I repeated one more time, that they get the test done early in the pregnancy.
All right.
It was eminently treatable. Now, for children, it is important for their intellectual development, it's important for their growth, and most important, I keep on saying to a boring extent, it is completely treatable. It's completely 100% reversible.
Right. But you know, many of our patients that come into the hospital often with pregnancy, they've been 3 months already pregnant, and of course they haven't had the advantage of somebody telling them, which you're telling them today, that they should not wait until 3 months and then come to see the doctor or their specialist, but they should have that thyroid tested way before they even get pregnant, or they're thinking about getting pregnant.
Or when they first become pregnant,
Yes.
first menstrual period, they should see their obstetrician, and they should he should decide, is it worthwhile getting thyroid function? I think in general it is.
Now, as far as male and female, are there differences in the gender of the who gets hyper or hypothyroid?
Well, that's an interesting question. I think there are statistics on it, and I'm not fully aware of it. My impression is that both hyper and hypothyroidism occur more commonly in women. Has that been your impression?
Yes, right. It has, yes.
And autoimmune disease in general occurs more frequently in women.
Lupus and those kind of things.
And of course, the important thing is it's women who get pregnant and need to have the replacement if they're hypothyroid.
That's right, surely. You know, a lot of women, for example, are when they have trouble with their uterus and they're bleeding and things like this, the gynecologist will readily take out their ovaries and their a complete hysterectomy and their uterus. Does that hysterectomy have any effect upon the thyroid? Is there any feedback from as far as the uterus is concerned or the ovaries are concerned with thyroid gland?
Well, the ovary, of course, secretes estrogen.
Yes, right.
And you know that estrogen increases the binding protein for thyroid hormone. So women, for example, who are on oral contraceptives, have extraneous hormone, will have high thyroid hormone levels.
Okay.
Okay?
Right.
Taking out the ovary doesn't do the opposite. It doesn't lower thyroid hormone levels.
I see.
So women who have had oophorectomy or have had a hysterectomy will have normal thyroid function.
Right, right. Now, as far as the history of the thyroid gland, when would you say in the history of knowing all about the thyroid that it became diagnostic, that is, a person or in the history of, when did you think they first thought doctors developed the idea of a hyperthyroid, for example? A person had, you know, we didn't have all these tests years ago.
You mean what were the leading symptoms?
Yeah, right.
A century ago, more than a century, a couple of centuries ago, the diagnosis was made.
I see.
And the most obvious thing is the enlargement of the thyroid.
Right, okay.
The other thing on physical examination is a very rapid pulse.
I see.
So people who had a rapid pulse and were tremulous had a tremor of the hands.
Right.
And then most important, unexplained weight loss.
Okay.
Unexplained weight loss makes people think of cancer, right?
Right, yes, surely.
But patients who are not treated for thyrotoxicosis lose a tremendous amount of weight.
I see.
Now, the other thing is hypothyroidism. What about hypothyroidism? Sluggishness, you seem to be stupid,
Yes.
cold,
Right.
slow in response, and curable with one little pill. Gorgeous, yeah.
Dr. Schussler, it's been a fast half an hour, but I can only tell you
Been a pleasure.
the information that you have given out today, I just repeat that one more time about pregnancy.
That's the most important thing. I think every pregnant woman early in her pregnancy should determine whether her thyroid function is normal, because the effects on the baby are irreversible.
Well, thank you so much, Dr.
Thank you.
Schussler.
Enjoyed it.
That's right.
Okay.
So you folks out there, if you got no more than that piece of information that we just gave you to protect that infant that you're carrying, because you certainly don't want to have a child that will be undeveloped in many ways. And that gland is so important, to make that diagnosis early if they or if they don't have, they're hypothyroid, it could be really a problem. So I would suggest that you, when you see a gynecologist or those who are expecting or want to have a baby, make sure that you have that test done. It's very cheap, and you have a lot of healthy babies coming around. So I hope to see you next time.